you come in to educate them. Hey, listen, you need to ask these certain questions.
I would tell you and encourage you to say, well, although they're normal, these are my symptoms. Is there any way that we, by optimizing that, we might feel or see improvement?
Welcome back to Knowledge Seeker Podcast. I'm your host, Farhan Mirza. So my today's guest is board certified medical doctor. She got tired watching patient dismissed, over medicated, and left home untreated. She got a mission that not only treat patient but also educate them how to take control of their health and treatment. So today she's gonna give you some tools so you can take back control of your health. Let's dive in. Dr. Basham, welcome to Knowledge Seeker.
Thank you for having me.
How are you doing?
Doing great.
So tell us, first of all, how did you got into medical field?
Yeah, so that is a very good long story. I grew up in primarily a Latino population, working class. A lot of times, the only way we got to the doctors if we were really sick. We didn't really have much preventative care, and I saw that was the story for a lot of people in my community. So obviously, I had to overcome being the first a lot of my family. So I was the first to go to college, graduate high school, and the first in medicine. And I knew that my mission for patient care was to work in underserved areas. So that was pretty much my drive to get me through a lot of hard circumstances to get where I am right now.
Okay. So you're born in U.S., right?
Yes, sir. I was born in Chicago, but my mother wisely moved down to Florida when I was about 2 years old and wanted to give me a better surrounding than she had growing up in inner city Chicago.
Okay. So when you said you the first one on a lot of things, so I'm believing that you the first doctor in your family?
Yes.
Okay. So what's the inspiration for you? I think we talked about earlier that, hey, in my family, there's two careers you can go with, doctor or a failure.
Oh.
But I mean, I'm sure it's something inspire you to get into this medical field. Do you have any mentor or do you follow anybody?
Yeah. So really, I would say my inspiration came from God and his working in my life. So thankfully in college, I was a part of a lot of organizations, which I had wonderful mentors and opportunities that I never thought I would experience. And some of those included going abroad. So my third year in college, we started an organization that allowed us to travel down to Huancayo, Peru. Yeah, and we served there for a week amongst each other and volunteered in different villages and rural areas. And we were able to bring down a lot of supplies. But just in that time, seeing such a need for medicine, not even, like I mentioned, in my local community growing up, but just worldwide in underserved areas. So that really gave me the kick and the spark. And I actually was able to go to a medical school, which allowed me to serve in other clinics abroad, like in Honduras and Dominican Republic. And so that really showed me that I was meant to do this work.
The medical thing, yeah. So, I mean, as you know, this medical system in America is kind of very tough. Not only tough, it's actually kind of broken. So what patient story basically made you realize, hey, the system is broken. I need to step in and become not only to treat patient, but to advocate them about things?
Yeah, so I think my disheartenment with the medical system started even before I started seeing my own patients, being a student, then being a medical resident, working 80 hours a week, and then to have the privilege to take care of patients and be licensed as a medical doctor. I saw the system countlessly, patients coming back right after they had left, patient diagnosis being prolonged or unseen. And I'll share a story about Mr. A.
Yeah, please.
Yeah, so Mr. A came and saw me in my practice, and he had a lot of concerns, and one of them were bleeding every time they used the restroom. He had seen multiple doctors, and it was always told that he would just be monitored and see what happens.
Mm-hmm.
But unfortunately, the first time I heard his story, I knew something wasn't right. I knew that it was probably life-threatening, and after getting him to the right people and getting him seen, he was treated for the next couple months for invasive cancer. So
Oh,
Mr. A's story, although it's shocking and striking, unfortunately, it's not rare. And
yeah.
it's happening more and more often where patients are overlooked. They're kind of just worked through the system, especially if there's no coverage or under coverage, then you have even more barriers to getting the care that you deserve. And it should just not be so, especially in such a resource-rich area
Yeah.
like the United States.
And that's the major issue because we have so many resources. We should not be having this difficulty in our medical system. And you're right. So usually, as you know, patients gets only less than an 8 minute with the doctor. So when they come to you, what do you advise them when they go to see their PCP or personal care provider? What kind of question they need to be asking them within this 8 minute period?
Yeah, so that is excellent because as now an independent patient advocate, although I still practice clinical medicine, my new mission in life is to have patients take back control
Yeah.
of their care. So in this role, I teach a lot of my clients and people that I see who have just been turned over and fallen through the cracks that this time that they have is limited, and you have to be strategic. You have to have your questions written down in advance. So I have them kind of go through what's important. What are they expecting to come out of that appointment? What do they feel like the one thing at least that they need to know before leaving? I also ask them to make notes or bring someone along beside you that might be able to help you determine or decipher what was said, especially when you're in a really high stress or you're getting a life-altering diagnosis. It can be really hard to understand anything else besides that diagnosis.
Yeah.
It's that critical period, that crisis period. So if you can have support, write down your questions, and ask for direct questions like, what is this test going to change? Or I know what you're ordering, but why are we doing it? What's it going to change? How is that going to affect my treatment or diagnosis?
Yeah, and usually when this patient goes to the doctor, their labs looks fine, but patient looks awful or they feel awful, and they say, "No, your labs are fine." So at that moment, I mean, what kind of advice you give them to ask doctors question, or maybe doctor is missing something?
Yeah, and I like to preface that by saying that, you know, at least most of us went into medicine because we really had that altruistic pull where we wanted to make differences in people's life. We wanted to see them healthier and happier and enjoying quality. But with 15-minute appointments and tons of paperwork and charting, that's why that appointment ends up being only 8 minutes. So I don't want anyone to feel like I am saying that all of it is on the doctor's end. A lot of times we're being pulled in different directions. So I say all this to tell you that there's ways in those confined spaces to optimize things. And that goes back to your question. Just because laboratory or blood work looks fine, what does that mean, right? So a great follow-up question would be like, what does fine mean? Can you please explain what you mean by that statement? And a follow-up question would be, although they're normal, are they optimal? That's a different, it's a different way to approach that. So normal levels can be within a range. For example, your vitamin D level can be 30, right? And that's technically normal, but there's tons of studies and research that show for most people, you really want it to be almost double that for it to be optimally working in your body.
Mm-hmm.
So I would tell you and encourage you to say, well, although they're normal, these are my symptoms. Is there any way that we, by optimizing that, we might feel or see improvement?
Yeah. So, I mean, the thing is that and you're right. Actually, it's not only on all doctors. I think patients need. That's why I think you come in to educate them. Hey, listen, you need to ask these certain questions.
Yes.
Before you leave the office, because I think when we go to the doctor, what they tell us, we just say okay, and then we get out and they say, why should I asking this question? I should be asking this question too. So that's where you come in as an advocate and for them. So I think so. How long you been practicing?
So I finished my residency right in the middle of COVID in 2020.
Okay.
Yeah, so I've been out and practicing a little bit after that.
And you practicing family medicine?
Yes,
correct?
sir. Yep.
Yeah. So most of your patients, are you treating mostly like women, or you have like different diverse group that you're treating?
Yeah, so the thing I loved about family practice and why I decided to do is that I get to see everybody and anybody. So from birth to 105, men and women. So that's what kind of keeps me very interested and engaged. I heard a quote recently that said, we're not generalists, we're comprehensivists, because we really do need to know a lot about a lot.
Oh yeah, that's a good one. So I mean, yeah. So when, let's say, a female patient come to you, as because you're a woman doctor, and she's scared, and to ask any question, how you guide them that, hey, you don't need to be scared. This is what you need to do.
Yeah, so my approach and the approach I would recommend for anyone in that situation is to build rapport. So it has to be both ways, right? Many times, if someone's scared, it's because they've had an unfavorable prior experience, or they're just not sure how to navigate what they feel like is a crisis.
Yeah.
So, what's helped some of my patients I know really just open up and allow me to come alongside them. And even with clients I'm working with, usually when they come to me, it's because they're in crisis, they don't know where else to turn. And they've tried all the conventional ways, and then they've found out that there might be this additional layer of support. And so they come and talk to me.
Yeah. So what do you think about the diet we have? I know you're also very advocate about having a plant-based diet too.
Mm-hmm.
How this will help, your patient or anybody who is having issues with their health. So how much they can basically include their plant-based diets in their daily calories, I guess.
Yeah, and there's more and more research showing that plant-based diet, whole foods is the more, I guess, acceptable term, because you can eat pretty bad without eating meat nowadays, especially in the American diet. But a whole foods plant-based diet has shown not only to reduce, heart attacks and strokes, but some cancers as well, and longevity. I'm sure if you Google blue zones in the world, many of those that you'll see the trend is that it's a plant-based whole foods diet. So I recommend it probably to all of my patients because when I see them, they suffer from a lot of lifestyle related medicines or sorry ailments. And then I've seen tremendous individuals who have adopted even some of those drop 10 to 20% of their total body weight. And myself, I have overcome a lot of health issues, including my weight, and have been working towards that by adopting a whole foods plant-based diet.
So yeah, tell us about your journey. How did you, trying to take care of your health now, what kind of routines or what kind of like you said, the diet you are following?
Yeah. So I have eaten a plant based diet, I would say, for 12 years now. When I first started, I was just finishing grad school, transitioning to medical school, and then you have to get like a physical and stuff. And the doctor who I saw was very kind, but very honest, and told me if I went the way I was continuing to go, that I would probably have diabetes in 5 years
Oh
or
wow.
worse. And so I had to really reflect on myself and say, hey, how can I go and practice medicine and tell people to be healthy when I am not taking my health seriously? So that spiraled into doing a lot of research and watching a lot of documentaries that once you see, you can't go back.
Yeah.
So the first thing I was like, well, let's just try something. So I did some fasting and some juicing, maybe some more of the extreme things, but it led me to be more balanced with adopting a plant based diet.
Yeah. So let's talk about intermittent fasting. How important that is for a human body.
So I think our bodies, if you look into history, I mean, fast and famine were just the name of the game, right? And I'm a big believer that God doesn't make mistakes, and so He's made our body to be able to adapt to
Yeah.
that pattern. But nowadays, with convenience stores and grocery stores, we don't ever have to go. We don't have to choose. Most of us here in the United States to go through the fasting, but it makes a huge difference. The thing that kind of convinced me this is legitimate is that after about 3 days of fasting, your body goes in something called autophagy or
Hmm.
autophagy, however you like to say it, and it starts to clean itself up. So, like mutated cells or precancerous cells, there's tons of research that your body takes that time once you've kind of just let it reset to clean itself up and to get itself back aligned.
So tell us about this 3 day. What do you mean by 3 day fasting? Meaning like 3 days certain time, or you just don't eat for 3 days, just drink?
Yeah. So some people just water fast. I mean, this is where the research is done. This is not medical advice, and
Yeah.
I don't recommend you do this without supervision if you want to. But from the research that they've done, it shows that after, those 3 days, and it's between more like 2 and 3, that your body is just like cleanup mode, cleaning everything up. But even for shorter periods with intermittent fasting, 16, 18, 20, those windows
Hmm.
are usually the most common ones, that there's tons of health benefits and longevity chances are increased. Skin can look better and more radiant. Your GI system has a little bit of a reset. Mood has been connected a lot to that as well with fasting.
Hmm.
So there's just a plethora besides, people usually do it to get back on track or to lose weight, help bring down like their blood pressure and stuff. But there's a multitude of benefits that come with fasting, intermittent
Yeah, I
fasting.
mean, not only that, also, plant-based diet, and also not only just fasting, you need to also move your body too, because the, that if you're not moving your body and you're just basically sitting and eating, and then of course it's going to happen that you're going to gain weight. But only if you're just doing a plant-based diet and not moving your body, I don't think it's also a good idea to. So in your practice, what kind of major issues or health issues, I would say, you see normally in patient?
So it's usually most lifestyle related, how I kind of alluded to earlier. So any family medicine practice doctor will tell you that they are very well versed in blood pressure, hypertension, diabetes, and especially after COVID, a
Hmm.
lot of mental health issues are on the rise as well.
Yeah.
But again, with lifestyle changes like eating better And that doesn't mean that you have to 100% not eat what you like, but just make more informed decision, read labels, have more of a understanding of moderation and what you're taking in. Having a good social connection, again, that's really part of a lifestyle approach. So, and as well as physical exercise, those three things together can make huge differences in people who might be suffering from chronic illnesses.
I think you just mentioned that the mental health crisis. I think it's very turning into a pandemic right now, especially in United States, and also not only. I think what I see mostly is in young people.
Exactly.
And I think that might be because of social media or the technology. What kind of advice actually you give to a younger patient who's watching this and he's or she's suffering any kind of anxiety or depression? What would you advise them to change one habit? What would that be?
Yeah, I'm glad that you asked that. So, my advice would be that you're not alone. It's possible to get connected, even if that's not through formal counseling or therapy. There's tons of support groups. There's lots of extracurriculars like church groups. And so just know that isolation, especially nowadays, how easy it is to do, can just worsen that. So my
Yeah.
one piece of advice is just get connected, get plugged in.
Be socialized.
Yes.
Not on social media.
Yes.
But in real life.
Yes, one-on-one conversations,
Yeah,
kind of like we're having
one
now.
on one. Yeah. So patients, when they come to you and you advise them, hey, you don't need to take. So first of all, okay, this is not a medical advice. This is
disclaimer.
Yeah, this disclaimer. This is I have to do this at the end too because Dr. Basham is a board certified medical doctor, but she's not your doctor. You need to consult your own doctor. This conversation is only for information and educational purpose only. So I just want to say that. So what patient, when they come, they thank you for taking off one medication. Actually, what I'm trying to ask you is, if patient come to you and say, "Hey, they thank you. Hey, please, thank you for taking me off one medication. What medication you would advise them not to take?" Disclaimer: not a medical advice.
I guess that one's a little easy for me. Would be probably all the medicines that are not benefiting them. So what happens is, and this kind of goes back into my advocacy hat, is that someone comes in for one ailment, let's say their blood pressure. We talk about lifestyle. They know what they need to do. It's probably going to take some time. So we can't have you walking around with your blood pressure through the roof until you're able to implement everything. So we might start blood pressure medicine, or someone might start you on that. But then if we're too aggressive, then you might start having dizziness.
Yeah.
So instead of addressing and doing a thorough evaluation, happens sometimes because of all of the dynamics around our medical system and appointments, then you might just get a prescription for dizziness medicine, which might cause another symptom. And then you're on 3 medicines when we could have just evaluated and maybe found out that we were over treating your blood pressure.
Yeah. Like, I think most patients are very over medicated. I think, like you were saying, that, hey, you are treating one thing, but then you're taking this medicine to take care of the side effects of the other medicine you are taking. And it's like a chain reaction kind of thing, like everything you're just taking. You talk about high blood pressure, cholesterol. So how we can basically take our life into a direction that we don't need to basically just only taking medication. We can have a lifestyle, that we can have some kind of a routine or some kind of a diet plan that will help our not only cholesterol but high blood pressure.
Yeah, so that can be a multifaceted approach, and I think each person individually, they really should work with a practitioner that they trust to come up with that plan. But most, I would say about at least 80% of the ailments we see here in America can be not only reversed, but completely alleviated by doing just the things we've already talked about with our lifestyle, being more socially connected and intentional, moving and engaging in physical exercise. But I also want to make sure that we're balanced. There are some things that will need medical treatment.
Yes.
And I never want to go one way or the other. I want to do everything we can, or when I have a patient, I do everything I can to treat that patient where they're at and what they're able to do. And if that means sometimes we have to use medicines, we use them wisely and judiciously. But we're always evaluating when we might be able to come off that or maybe do something alternatively.
Yeah. So do you have any story about your patient that he or she changed her health, just basically changing her lifestyle, and it will help her or him to control their health?
Well, I'll share a story about, technically it wasn't my patient, but someone I know really well, that asked me lots of questions. And, you know, you always get those phone calls if you're the doctor that someone knows. Especially after they've seen their doctor and then they didn't ask the questions that they had, but then they asked me. So I get to do that now professionally as a patient advocate. But for this person, you know, from intermittent fasting alone, cutting out sugary drinks, which, I mean, we could go into an hour of how much empty calories that will add to our diet that we're not even aware of. Just walking and moving, was able to completely alleviate most of their medication regimen, and also not only feel better and look better, have a better quality of life, be more engaged in their family, with their children, go on trips and vacations and not have to worry about the seat fitting them at the theme park.
Yeah, that's a big one. Because I know someone actually who is kind of unfortunately overweight, and they get mad when they go this kind of a places and they can't fit in those seats.
Yeah.
So my usually thing, it's not their fault. I think that might be a wake up call for you, that you need to do something about your health. Because if you don't have a health, I think you don't have anything.
Yeah, you're on borrowed time.
Yeah.
Even more borrowed time.
Yeah, because if you have $100 million and you don't have your health, what that $100 million is going to do to you? You know, you can't get your health back. And so, yeah. So, let's say if you have a magic wand and you need to change one thing about American medical system, what would that be?
Oh, you give me a lot of power.
Yeah.
Well, I think that's what I'm kind of working towards now, would be that the patient is more informed and in charge of their health. I think far too long, and that might have come out of paternalism, you know, whatever the doctor says, we don't question. And that was kind of just how we did things. But it would be to know that at the end of the day, you're the one that has to deal with your health. You're going to be the one that suffers either the positives or the negatives of it. So I would love to have just more patient engagement in it, well-informed patients who are going in and making well-informed decisions, and not things with half information or feeling like they're pressured or forced right away to decide yay or nay on something that might affect their whole life and then their family's life as well.
So, you are advocating your patients. You also educating them about the plant-based diet and lifestyle medicine. How's your coworkers reacting to all that kind of a thing? What's their take on those?
Yeah, I think we talked about it a little bit. I'm thankfully part of a great organization, and that is the move that we are on, because it's where medicine needs to go, is to more of a lifestyle approach, mind, body, and spirit, because all of those are part of the people that we see and we care about. So thankfully, I'm in a well-supported place, although I have not always been in that situation. Now I really feel like I feel like if you're not doing it, especially in the medical field, then you're going to be chasing your tail down the road because a lot of things are going towards value-based care. And what are your patient outcomes? How healthy are they actually? How much are they not needing the medical system than just the number of people coming through your door that you're treating?
Yeah. Um, so do you think that patient become numbers rather than like basically healthcare should be caring patients? And I think we talked about a little bit earlier that, hey, that these patients turning into numbers. And I think that's kind of very sad because, so what would you say to a doctor, I'm talking about your colleague, who thinks that the lifestyle medicine or this plant-based diet is all voodoo?
I would just encourage them to do their own research, especially go back to, anatomy and physiology, pathophysiology, and especially for most of our lifestyle ailments that we're treating. And even there's been an excessive rise of cancers. Those trends usually follow the decrease in whole food, natural foods, exercise activity, stress, and busyness patterns in America. Usually, when those things decline, then the amount of illness and disease that we're treating increase.
Yeah. And I think we also talk about, pharmaceutical companies, they also have a lot of power and they have a lot of money too. And I think when they're educated, but when they say, oh, the plant-based diet, that's just voodoo. That's just, some kind of a magic. Or, if you do lifestyle medicine, this is nothing. Because they, I think, mostly focus on the science medicine, which is, of course, you can't, like you said, you have to have medication too, because there's science-based medicine.
Mhm.
But it doesn't mean that you just only rely on this, just pills. Because there's doctors I call them pill pushers. if you have a headache, they will, oh, you need to take that. So those doctors, what do you think that they can change in their practice to basically basically incorporate this plant-based medicine or lifestyle medicine?
That is complex because I think that goes back to our training here in America. If I recall correctly, we probably had about 12 weeks of nutrition training
Oh, wow.
all together in our, 4-year medical school training. And then even less of that exposure after, unless you seek it out yourself. A lot of times, nutrition and diet counseling is not much incorporated, even though most of the ailments and diseases that we treat are directly related to overindulgence or eating too much of one thing, like
Yeah.
salt for high blood pressure or processed carbs for diabetes. Not always the case, but majority of them are. So I think it just goes back to our training. That is probably another whole episode you could probably do on the trend of the differences in medical training with more of an input in pharmaceuticals.
Uh-huh.
So our pharmaceutical training much outweighs our nutrition training. So in some parts, I know it's just kind of the game and how things have come about in our certification. But in other parts, as someone who cares about patients and who sees patients, we have the ability to do additional training. And with the internet, there's so much at your fingertips that you can really dive into. So I would just encourage them to educate or just re-educate themselves.
I think the power I gave you earlier, the magic wand, I think you can you can change that with that.
Yeah.
No, you're right. Actually, that's actually, kind of sad, but, so let's talk about your practice. When patients come to you, how you approach them? What kind of, first of all, I'm pretty sure you don't just take only 8 minutes with them. You basically, so how your approach with the new patient?
I mean, when we have new patients come in, a lot of it is investigative work.
Yeah, yeah,
And
that's what I
even,
mean.
yeah, even with my clients, with who I see for patient advocacy, a lot of it is finding out their story. So finding out where have they been, where are we right now, and where are we trying to go. And the chart tells a lot of that, labs and testing and imaging, that tells a lot. But the patient themselves and their presence, their conversation, and having them tell you their story tells you so much more too. So I really try to spend a lot of time with anyone who's seeking my help, whether it's in patient advocacy or in my clinical practice, is spending time to figure out who they are, what's of value to them, and what are their real concerns. Because someone can tell you, well, I'm scared about this lab, but really what they're scared about is that they might pass away and their mother has no one to care for her anymore because they're the only ones there. So really finding the story behind the story.
Can you elaborate more on that? Because that's a very the important part you said that they're not basically worried about their lab numbers, but they're mostly worried about what happened to them and then what's happened to. Yeah, please.
Yeah. So
Do you have any story or do you have any like patient that, went through all that kind of thing?
yeah, so I have multiple stories, unfortunately. And even clients that I talk to that they're the primary caregiver for their spouse or for an elderly or aging parent. Um, if you look at the baby boomer age now, there's this thing called, there's a big gap, the sandwich generation, right?
Yeah, yeah.
So working professionals, midlife professionals who are having to adjust majorly their lifestyle to care for a elderly or decompensating loved one. And so they spend so much time taking care of the other individuals that a lot of time their health
It's deteriorating. Yeah.
exactly. So when I see them, a lot of time it's because they have questions or concern about impact of results or testing, or they've had to go to the hospital because they've just let things go by the wayside. But then what I really find out is that their real motivation is so that they won't leave whoever's depending on them alone and abandoned.
Yeah.
So we just have, I can talk to them all day about why they have to do this, and this. But when I understand what their actual motivation is, like I might tell them, you need to lose 30 pounds so that your blood pressure will be controlled and you don't need 3 medicines to control your cholesterol and your diabetes. But I tell them, hey, we need you to lose that weight or try because it'll allow you to have a longer life, be able to get up and help mom, lift her up if she falls. Then it hits differently.
Yeah,
At that
it's
point.
like personal, make it personal kind of thing.
And I think that's where the humanity is kind of lacking in medicine. And again, with the rush appointments and having back to back or maybe double booking, it's hard to really sit down and look at a person to get to that point where you're learning their story like that.
So yeah, how we can change that, Dr. Basham? How we can change this kind of a system? Because you are in the medical field, I think in your own level you are trying to do that, but how we can basically educate other your coworkers or medical doctors that hey, they need to do this kind of a thing too.
Yeah, and I think not just myself, there's a lot of us who are even physicians working in the advocacy space who are taking on this role because we're trying to fight back, right? We're trying to fill in those gaps where patients are just kind of left out to dry, or maybe they've seen 5 different specialists and no one is talking. So then now they're just kind of at wit's end or feel like there's nothing else that can be done. So we're trying to fill in those desperation and those areas of darkness where they feel like there's nowhere to turn.
Yeah.
But it has to be, like you said, a larger movement. And I feel like until physicians really unite better to work against what's standing in the way to block us, like all the paperwork and, the revenue concerns and just getting people in and out until we unite to fight back because we're the ones that have to sit down. We're on the front lines. I don't know how much will change besides us in our little camps trying to make a difference.
I think like you are making a difference. So if somebody listening to this, I think most physicians, they are very caring. They want their patients to be cared and they want the best of their patient. But sometimes I think their hands are kind of tight because the way we have a system and which is very unfortunate. And I think because politics involve too much into our medical system. And when the politics involve in anything, everything goes so much delayed and everything.
Not to cut you off, but another major concern that I don't know many people know is that a lot of healthcare decisions are not made by the people seeing the patients or the physicians. A lot of it's done on different levels, administrative levels. Like you said, there's some political aspects of it, but those who are there day to day in the bushes or in the woods, on the front lines are not the ones that's actually making the decision. So we're just dealing with the effects afterward.
You mean the provider is taking care of the patient?
Is not usually and not the table.
Oh, wow. Yeah. Wow. Yeah, that's big.
Yeah. And I mean, that goes back to even hospitals not being able to be owned by a doctor.
Yeah. I think that's one of the things. If I had a magic wand and I had to change something, I would change the CEOs of all medical hospitals and turn them in, hire them as medical doctors, who knows how to basically do medicine. Because I think the CEOs, not that they're bad or something, but they don't know what's going on the ground level, who's taking care of patients like you guys are. The doctors, who's the one who's taking care of patients. Yeah. The CEO is not.
And it's really difficult because most doctors are not good business people. We don't get taught that, right? So there's always the balance, but it does make me sad when you see major decisions being made or changes to care, and then there was nobody who's doing the work involved in that. And I think that's where we need to be better. I do think there's a place, for the administrative part, but there should be much more balance in that than there is right now.
I think in medical system, like you were saying, I think too much administration is involved. I think that's, in my opinion, that's one of the problem, because administration, they are business-minded people, and they are doing this, like taking healthcare system as a business entity rather than healthcare entity.
Yeah.
And that's why the patients become numbers. And then also there's a pressure on you guys as a doctor. Hey, you need to see that many patients a day because it's a business now.
Yeah.
And that's, like I said, that's, major problem. And that's why our medical system is kind of falling apart.
Yeah. And I mean, if you look at all the statistics, although we're, first in a lot of advancements, the only thing you would want to have in the United States is a trauma, because we can do that really well. But in preventative care and maternal care and infant mortality, we're far lacking. It's not too much to brag about in our outcomes and our statistics. So there is a lot to unpeel from the onion of the layers. But like I said, I'm just grateful where I practice now. We're moving and we're trying to do our part. And then with me being an advocate, I'm helping in the other gaps where patients might be falling through the cracks.
Yeah. And that's. So when patients come to you and their labs, look bad and they are, we talk about that, they are feeling bad. So what kind of advice you tell them, hey, listen, you need to trust your body, that what your body is saying to you, not basically just, take this medicine, that medicine, this medicine. what basically you teach them? Hey, listen, you need to listen to your body, because in yeah, I usually say that, hey, listen, your body will tell you what's going on. It will whisper you first. If you don't listen, then it will hit you with a brick. And if you don't listen, then it's going to run you over with a truck.
Oh, yes.
So before we get into the point that this is going to run us over a truck, what preventive measure we can do so not to get to that point?
So I think it takes being honest with ourselves. And even if that honesty means like, I know what I need to do, but I don't want to do it.
Yeah.
It's a hard pill to swallow, but it allows us to come in and figure out, if we can't get from A to Z, maybe we can start at H and then work our way down the line to get you where you need to be. And again, that goes with meeting someone where they're at. Like I can see someone and they're working third shift, right? They're working paycheck to paycheck most of the times. They get no sleep because their sleep schedule's all. And then they're also having to deal with financial stressors. I can tell them, like, you really need to do counseling and therapy. And they'll laugh at me and say, when am I going to do that when I'm barely holding on? So maybe not therapy, but we can work on some intentionality and being mindful and small steps first to see if that makes any impact instead of just not doing anything at all and giving them just a medication.
Yeah.
So you can definitely incorporate and do small things even if someone's not fully ready for change.
And I think we say, the only constant thing is change, because it's always change.
Definitely.
And so let's talk about sleep. First of all, what's I mean, I know everybody says, oh, you need a 6 hour, you need 7 hour. What's the golden number here?
I think the number I can give you that'll get less in trouble, where it's about 6 to 8. 7 to 8 is ideal, right? That's what you want to try to get every night of sleep. But the number 2, I think we focus on a little bit too much and not the quality of our sleep.
Yes.
Because there's different levels of sleep that you get into, and you have to hit a deep sleep to really get that restfulness and the regenerative benefits and the repair that your body does in there. So people can sleep 12 hours, but if they're not ever reaching that deep REM sleep, then they're not getting the full or much benefit from it. And then with TVs and our tablets, our connection to the world, and just high stress environments, it makes it harder and longer to get into that sleep.
No, you're right. So it's all about quality, not the quantity kind of thing. Yeah. But yeah, you need to have at least 6 to 7 hours, you said?
7 to 8 is ideal. Okay, some people can do 6, but again, it's really important, like you said, how much quality of that time are you getting in?
Yeah. So if what's someone listening to this and they need to change one habit today to become towards their betterment of their health, what one habit you would tell them to change?
This is good because I don't think we talked about it. Is just drink more water.
I
mean, we're 70% water.
Yeah.
And I just think it's one easy thing that we all can do, no matter, what you're doing, where you're at, how much money you make, you can drink more water.
So the drinking water, I mean, of course, also there is a lot of, you need to drink this much water, that much water. I think when we sleep, as we got dehydrated, and when we get up. So my thing is that I actually drink water in the morning, kind of like a warm water.
Yeah.
And that basically helps my gut. And I think that's a good advice, that just drink more water, especially when you get up in the morning.
Yes.
And also,
because what do people usually drink when they get up?
Yeah. Coffee.
And then coffee makes you more dehydrated. Yeah. And then by the time you realize that it's about 1 or 2 and you haven't drinking anything else but your cup of coffee for the morning.
So also, since you're talking about coffee, as you know, there's research, oh, coffee is good for you. Then there's a second research, coffee is not good for you.
Yeah.
So can you debunk this thing? What?
Man, you're giving me a lot of power today. Okay, so everything in moderation. If you can not drink coffee, most likely you will do better because that's a lot of where empty calories come from with the big chains and getting a 20 ounce with whipped cream and sugar. So people don't just drink coffee, they drink milk and sugar with a side of coffee in it.
Ah,
So I think everything in moderation. However, I think most of the research says about 1 to 2 maximum if you are going to drink coffee is probably going to be the best long term.
well, okay. So tell us what kind of a challenges you face when you talk about your advocacy and plant-based diet and lifestyle medicine.
Yeah, I think it's just, especially with patient advocacy, I always get the question, "What is that?" or "What does that mean? What do you do?" And so, with it not being as well known, and a lot of us kind of doing the work. I mean, I advocate for my patients since I've been practicing. Especially as a PCP or primary care doctor. You're the front line. You're there trying to get people seen and interpreting labs and answering phone calls of the unknown, even though you don't even know what medication was prescribed. Your patient will call you because they trust you. So I always explain that I've already been doing this work. I'm just opening up myself to other people and not just my clients.
So yeah, actually, let's a little bit talk more about your patient's advocacy. So what your role as an advocate for your patient? What would you do like when patient comes to you?
Yeah, that's a good question. So I don't diagnose, treat, or prescribe because that is practicing medicine. And
But
so,
you are a medical doctor.
yes, I am a medical doctor, but what I do is I use what I've learned in the medical system and I use my knowledge of dealing with insurances and different barriers that I see to help someone who's just been through the ringer. So, for example, I recently had a client that had been to the emergency room 3 different times with debilitating weakness and had seen multiple specialists, and no one can give an answer. And then the only next step was, well, we'll send a referral, but it might take up to 2 years to get seen. And so this person's dealing with debilitating symptoms, and with the only hope being that, well, maybe we can get you in 2 years to get further workup. So it was my job to review everything, make sure that there was no gaps in the care, make sure there's not further testing or imaging, and then find someone that can help them a lot sooner than that. So I come alongside them and figure out, what have we done, what hasn't been done, or what else can we consider.
So when patient come to you, like as advocate for them, so you basically take care of like communication, I guess, for
Yes, sir.
them. Call the insurances.
I can, yeah.
Okay. Call their PCP doctor.
I can do that too.
Okay.
Yeah. Or call the specialist or call around and see who might be a good fit for them. What I don't do is make decisions for them. So I don't want to ever take that autonomy that's already been a power struggle throughout most of their medical care, a lot of times by the time they see me.
So you kind of providing like a concierge service kind of for patients, like, hey, if you come to me, I'm a medical doctor. Because I've been through on that side too. Now I'm here, I can advocate for you to basically talk clearly because you are in medical system, the medical terminology, and of course you know how the insurance is working.
Yeah.
So for a patient, so let's say if I'm a patient, I've come to you.
Yes, sir.
You take care of all the, I guess, paperwork from me, and I'll give it to you, and then you can take care of all the.
Yeah, so I can be as involved or not involved. That is usually the point where most of people who end up needing me are at the point, is that they've exhausted all the avenues that they've known. They've tried themselves to appeal decisions that they didn't feel were correct or just with their insurance. They're hitting standstills getting in with the specialists that they need, or saying that things are not covered that could be life saving
Mm-hmm.
or life impacting or their quality of life. And so, because they're not able to have 2 or 3 hours to sit down with their primary care medical provider or the specialist that's been helping them out, then I can come in and fill in those gaps where they're not
Okay.
left.
Okay. Yeah, no, that's actually, I think, very good system or model, business model system or something. So let's talk about Dr. Basham.
Oh, sure.
So we talked about you earlier. You said you had your health issues and all that, and you also, lost weight and all that. So what kind of a diet routine you had, or what kind of changes you did change in your routine or in your life that to be more healthier?
Yeah. So at first, I think I had to change my mindset. Growing up, food is a love language.
Yep.
Food is everything.
Yep.
And especially being from Puerto Rico, the Caribbean, we eat lots of maybe overindulgent food if you're not doing it in moderation. So it became kind of a crutch and a comfort for me when I was stressed or sad or disappointed. I used that to fill my gap. So I really had to change my mindset, and that came with strengthening my relationship with God and the Lord, or knowing that food is to nourish our body and to replenish it, and it shouldn't be filling in gaps that He should be filling in for me.
Mm-hmm.
So that was the first thing. And once I was able to kind of overcome some of those unhealthy relationships with food, then it became easier to make small changes that led into a significant amount of weight loss, but also just wanting to be healthier. So I wasn't just doing it for the way I wanted to be healthy. I wanted to be able to run. I just ran my first 10K in October, which I couldn't even run a mile a few months ago.
Wow, congratulations.
Thanks. Yeah. And I wasn't fast. I call myself a light jogger, not a runner. But it was something I couldn't imagine doing a few years ago. And just enjoying being healthy and not being a drag or feeling like, well, I'm in a diet culture, I'm having to do these things. It's finding pleasure in having a healthier quality of life.
Quality of life, yeah, that's the thing. But did anything like triggers you, or any kind of a scary thing happen to you that basically change your mind? Hey, listen, I don't want to be going through like that. I want to be healthy, because usually something happened, unless something happened to us seriously, we probably not able to change.
Yeah, and I would go back to that conversation I had with my family medicine doctor when she's like, you're in the pre-diabetic range. Yeah. And I have many family members and people I know who have lost limbs and vision and their life ultimately from especially diabetes. So for me, that was that shaking moment that, I thought I was invincible at that point, but then they brought me back down like, no, you can suffer these same things if you don't make changes, if you don't do things differently.
Yeah. So you're a mom. Yeah. You have 2 kids. You're a wife.
Yes.
And you're a busy doctor. How you balance all that?
Lots of prayer and grace. But it's all about, routine and having your priorities in check. So yes, I'm a wife first, and then a mom, and then a doctor, and then an advocate.
Yeah, that's what I'm saying. You're wearing a lot of hats.
Yeah.
How you balance all that?
Yeah, so I think it's remembering that's the order of things, because there has to be an order. If not, there'll be chaos. And especially when you're trying to balance multiple projects, and knowing me, I don't like to stay still or busy, but being okay in that stillness and knowing like that's for a purpose too, like scheduling in time where I don't have to do anything and it being okay.
Yeah. So of course, as you know, holidays are coming, especially Thanksgiving is coming. So do you have any advice for people who trying to lose weight? And of course, when they go to these, these gatherings, of course, there's food. What would you tell them? Hey, listen, you can eat maybe, I know you said moderation is the key, But there's certain advice you give them. Hey, listen, you can eat this, but try to avoid that.
Yeah, so I have that conversation a lot with many of my patients because we're by this time of the year, January is the big reboot. Then we
Yeah.
have a little falling off, and then we see them back. By this time of the year, we're kind of working to get things on a stable level. I would tell them that, you definitely, if you deprive yourself, then what ends up happening a lot of times is then you just overdo it and overindulge. So, my my advice would be that if you do it, I mean, something as simple as using a smaller plate so it looks full, little tips like that, or eat your fiber first. So you can eat your salad first or whatever vegetables there first and eat a lot of that.
Yeah.
And then you can indulge in the treats and the sweets.
Sweets, yes, because I have a sweet tooth. So, I mean, we talk about sugar. Yeah, I mean, also the soft drinks we drink. Actually, I was reading the article actually one day, and they said there is 16 teaspoons in 250 ml. That can has 16 teaspoons of sugar. That's a lot.
Yeah, it's probably more than your whole daily value. That's
Yeah.
allotted.
So what's the daily value for a healthy man or woman for a
So I don't know that off the top of my head.
okay.
I'll have to definitely look that one up
I think
after
it's the
here.
calorie wise 2000 calories.
Oh, yeah. So did you meant for a day to eat? Yes. Yeah. So it's about 2,000 calories. But for sugar wise, I don't know that one off the top of my head. But we consume way too much sugar, and it's not only in sweets and treats, it's in things that you don't think of, anything that's usually in a package or a container.
Yeah.
A lot of times reading those labels will make the whole difference. And I tell even people with high blood pressure that, like, although you don't add salt to your diet, anything that's in a packaged process or a can, you have to be aware of what's in there.
I usually say that if anything comes in a box, don't eat that.
Or put it on eat less of it for
Yeah.
sure.
If you really have to eat that,
Yeah.
then yeah, you just basically try half a portion. Actually, I had a guest here. She was a nutritionist too, and she actually gave a good idea. She said, when we go to the restaurants, of course, our restaurants, the meal portions are so big.
Huge, yeah.
She said, actually, what you need to do before you eat your meal, just make a portion of it, half of it, and just box it one half and just eat the half thing. And I said, I think that's a great idea.
And some people, I mean, fresh fruits and vegetables, although the research goes back and forth if it's actually more expensive to be healthy or not, it's not feasible either. They live in a food desert or things are not in season, and when they are, they're expensive. But even if you have to get something in a can, you could always rinse the food off, rinse it off, pour it off, and a lot of times it'll get rid of that extra sodium or any of those added things in
Yeah,
the
and
food.
sodium. We have so much sodium in our diet. It's actually kind of unbelievable because the content of sodium, when I see the label, is so high. And I said, oh my God, this is like crazy. So, I mean, I know it's basically a long shot to basically change the whole system in America. But I appreciate that you are actually at least doing in your level, trying to educate patients. Hey, listen, you don't have to be afraid to ask questions.
Yes.
And also, you're also helping them to take care of their power back for their treatment, for their health. So before we wrap up, anything else you like to share with our audience that hey, you can do this too?
Yeah, the thing I would share is that you're your best advocate. Although, your doctor and your medical team is there to help you, at the end of the day, if you don't ask the questions, if you don't ask for clarification, and if you don't ask for clear direction, then there's more risk that you're not going to get it and you're the one that's going to be dealing with the consequences long term. But all those things you're entitled to. So I really encourage people to have those hard conversations, to write down those questions, and to make sure they're doing everything they can to get the care that they deserve.
Yeah. So in your own family, like your husband or your kids, basically, how you educate your husband about all that?
Well, he does a lot of co-educating with me too. We follow a lot of the same mind frame, and he's seen my struggles throughout the highs and lows, and so he kind of has an insider view
Okay.
of the medical system. But he is my greatest support and cheerleader. So
Good, good. Yeah. I mean, if your spouse is supportive, yeah, that's a blessing.
yes,
Yeah.
beyond a
Yeah.
blessing.
So, Dr. Basham, last question.
Okay.
What kind of a legacy you want to leave?
I want my legacy to be that anyone that came in contact with me felt like I treated them as well as I would treat myself.
Beautiful. Yeah. I mean, if every doctor, which I know most, like I said, most doctors are very caring. They want best for their patient, but sometimes the system, the administration and all that is basically tie their hands. So,
Yeah.
well, yes, go ahead.
I was gonna say, yeah, it's a tough world, but there's hope. And there's
There's
a
always
lot of
hope,
us
yeah.
in the background doing what we can to make even a small change.
Yeah. Well, Dr. Basham, thank you so much. Thank you
Thank
for sharing
you.
your insight. Thank you sharing for
Yeah.
your knowledge. So if people needs to contact you or find you, how they can find you?
Yeah, so you can find me on social media. It's pretty easy. It's called the Advocacy Doc.
Okay.
My website is courseofcare.com.
Okay.
And you could just put my name in Chattanooga, and I think it pops up there. I'm even in the little AI description, so that might help.
Okay. It's called Course of Care.
Course of Care.
Okay.
Mhm.
So, well, again, thank you so much. Thank you for your insight. Thank you
Thank
for your
you.
knowledge, and especially thank you for your time.
Wow.
And thank you for tuning in. And if you like this episode again, please subscribe, share, and please comment that what kind of a health issues or health problems you are dealing with, and what would you recommend to be, better system in America or something like that. So thank you again. Until then, we'll see you in the next time, and keep seeking.